Okay, so look, welcome everybody, kia ora, for our New Zealand visitors. Welcome to this particular webinar. I'll just introduce the staff from the centre who are online. Dr. Barbara Murphy, Principal Researcher, Associate Professor Rosemary Higgins, Researcher and Clinician, and Dr. Michelle Rogerson, one of our research team, who will be handling the Q&A session. Just before Barbara starts her part of the webinar, just like to welcome we've currently got over 80 people online. And before we start, just want to acknowledge the traditional custodians of the lands on which our webinar presenters and participants are located, and pay our respects to elders past, present and emerging.
Thanks, Alan, and welcome everyone. Just one tiny bit of housekeeping. We do have a Q&A function on this webinar session. And for the latter part of the session, we'll be addressing all the questions. So please use the Q&A function to put your questions in. Michelle will answer as many as she can as we go in the text, but we'll also put those questions to the panel, which is mostly Rosemary and Alan there. So please do use that. Don't use the comments option. And how we're going to structure the session here is, the first 10 minutes, I'm going to give you an overview of the services that we offer at the centre to support our cardiac patients and how they interrelate with your services, and also a bit of background on how we came to develop them and why. Then we're going to hand over to Rosemary, who's going to talk through a couple of case studies around the types of clients that we're starting to see coming in. And then Michelle will moderate the Q&A that Alan and Rosemary will address. So just a little background on the Australian Centre for Heart Health. Our mission is to improve the lives of people with heart disease so they can lead engaged and productive lives. And we do this by focusing on the psychological and behavioural precursors to and consequences of cardiac events. We're the only research institute who focuses exclusively in this area of psychological and behavioural support. So this is our area of specialty, and we're here really to support you in your other service provision for cardiac patients. Our research supports self-management, behaviour change and psychological health as the keys to improving cardiac wellbeing that we can offer. So you may or may not be aware that we've got 3 pillars to our work that we do at the Australian Centre for Heart Health. We have research, which we've been conducting for over 20 years now, in this psychological and behavioural area. We run training programs, both online and face-to-face, with health professionals like yourselves working in cardiac rehabilitation and primary care. And more recently, we've initiated the Cardiac Wellbeing program, which is really what we're here to talk about today, to support cardiac patients and their families in their recovery post-event. So I'll tell you a little bit about our research and how we've come to develop the Cardiac Wellbeing program. We've been running our research program for over 20 years, which many of you will know, and we've been publishing in this area during all that time around the psychological and behavioural aspects of recovery. We know that mental health problems are very common after a heart event, with high rates of anxiety and depression, and these compromise behaviour change efforts and interfere with cardiac recovery. We also know that patients and their families need psychological and behavioural support, and many do not currently receive that in a comprehensive manner. They do receive some, but not necessarily all that they require. We also know that theory-driven self-management programs that use CBT, cognitive behaviour therapy, and motivational interviewing are effective, and by developing people's self-management abilities, that can support not only their short-term but their long-term cardiac recovery. Just one example of our research, or two I'm going to give you. This was a paper that was published earlier this year in the Frontiers of Psychology. It's based on a cohort of 900 patients in their post-event period. They were from 5 different hospitals in regional and metro Victoria. We interviewed them shortly after their event, again in the early convalescent period around the 2 to 4 month mark, and again in the what we called later convalescence, 6 to 12 months mark. And you can see there the rates of anxiety or depression. So in that early period, nearly 50% of the patients, and these were consecutive series of patients, so not just people putting their hand up saying they were depressed, were classified as anxious or depressed in that early period. And still by the 6 to 12 month mark, we had almost a third of the 900 people were still showing severe signs of anxiety or depression. We were able to predict who was more likely to have these mental health challenges that were ongoing, and they were the ones who had history of depression, younger, they were socially isolated, they were experiencing financial strain around the time of their event, they were more likely to smoke, although we do have a small number of smokers, and they had obesity or diabetes. So as soon as you have around 3 of these red flags, you're almost 80 to 90% guaranteed to have anxiety or depression in that later post-event period. So when you look at your patients, once you tick off three boxes, you know that these people are at increased risk. Looking at our translational work, and this is, I'm introducing this because this is what a lot of our programs that we currently offer are based on. Around 8 to 10 years ago, we developed what was called the Beating Heart Problems Program. It was a group-based self-management program based on CBT and MI, with sessions on health behaviours and psychosocial health. We ran a randomised controlled trial with 275 cardiac patients consecutively admitted to Royal Melbourne and Melbourne Private. And we demonstrated that being in the treatment arm resulted in a reduced 2-year risk of a recurrent event, reduced incident depression and depression severity, and improved functional capacity and health behaviours. So it was on the basis of this group that we developed up many of the components of the cardiac wellbeing program. So it's built on all this work that we've done and the needs identified in our research. The services that we offer are evidence-based, based, as I said, on the Beating Heart Problems program. And we aim to improve, reduce patients' risk of a future event by improving their psychological and behavioural recovery. So the cardiac wellbeing program has 4 key components at the moment. The first 2 are Back on Track and TeleHeart. They're both versions of the Beating Heart Problems group-based program that we ran based on CBT and MI. First one's an online program. The second one's a telephone delivered program, and I'll go into those in a little more detail. Most excitingly, we're running a cardiac counselling clinic. So this is for people that you can refer to us and they will see a trained, specialised cardiac psychologist who's registered. So we have clinical psychs, health psychs, and also mental health registered social workers who are providing one-on-one counselling services. Many of you will know we also have the Cardiac Blues project where we provide written and online supports for patients around emotional adjustment. So just to talk a little bit more about Back on Track and TeleHeart, the 2 programs that we offer, they're both 5 sessions. One's 5 modules online and one's 5 sessions over the phone with an expert facilitator. We're offering these both at the moment. Both are based on the Beating Heart Problems program, and they're designed to help people make lifestyle changes to support both their behavioural health, physical activity, diet, smoking cessation, and their emotional recovery, which is their anxiety, depression, post-traumatic stress, and also their social supports. They're based on self-management, so they have strategies around clarifying goals and values for the individual, weighing up pros and cons of the behaviours or areas of their life that they want to focus on, identifying barriers and enablers, and making action plans for what to do and coping plans for how to do it when things might go wrong. So they're quite complex, but simple for the patient or the client. As I said, they're based on the evidence-based program, and we've piloted both these programs, and you can see the publications there, which you're welcome to get hold of. This slide Rosemary's put together, she's developed predominantly these programs, Back on Track and TeleHeart, as a health psychologist. So as you can see on the slide, This just ticks off the components that are in both Teleheart and Back on Track. They both have the self-management program focus. So patients select their own areas of goal attainment that they want to focus on, and they make their own goals. They're informed by behaviour change theory and incorporate behaviour change techniques, including problem-solving skills. Their evidence-based techniques are incorporated into the programs, and these are designed to complement and extend traditional cardiac rehab programs and primary care, so the usual care that patients will be getting. And as you can see there on the right, there's strategies around goal exploration, behaviour change planning, and behaviour change maintenance. These are just some screenshots from the Back on Track program. If you are interested to look at it, if you're not sure if it's right for your particular clients or patients, Michelle is able to give you access to that if that's something that you think would be helpful. This is just a testimonial from one of our people who's currently involved in our trial of Back on Track that we're running at the moment. And as I said, most excitingly, we're now offering a cardiac counselling clinic. This offers one-on-one specialist support for patients who require more individualised support, particularly those who are experiencing anxiety, depression, or post-traumatic stress, or other mental health challenges. As I said, we've got a team of registered psychologists. We're currently offering these as telehealth. We began as face-to-face, but with the lockdown, we've gone exclusively into telehealth. And the great benefit of that is we are offering the service to people right across Australia, which is really exciting. And these sessions, our philosophy is that we're not charging patients money out of their pocket, so our sessions are all bulk billed. And Rosemary will explain a bit more about how you can refer people. Many of you are aware of the Cardiac Blues resources, and these are available through our website at a very minor cost, just for postage and handling. So we've got a patient brochure and an online module. There's also a health professional training module on the Cardiac Blues if you're interested to pursue that. So I'll now hand over to Rosemary, who's going to talk more about these 4 components and the types of clients that you might find are suitable. Thank you.
I'm unmuted now. Hopefully everybody can hear me now. I just wanted to sort of help people differentiate between what sort of clients they would refer to which programs. 2 of the programs are really very much focused on emotional and behavioural recovery, whereas the cardiac counselling clinic it'll be very individualised plan of care. So talking about some of the traditional clients that we might have through, I'll get Barbara to forward the slide on. George, none of these are real case studies. These are ones that I've formulated based on my experience with patients after a cardiac event. So George had an AMI and a stent 3 months ago. He's married with 2 adult daughters, had sleep difficulties since the cardiac event, which isn't atypical. Previous depressive episode in his mid-40s, but he's telling me that he feels like it has a ticking time bomb in his chest. So there's a few flags here. He hasn't planted his tomato crop and he's avoiding friends and family. He's also reporting feeling guilty about his performance as a father and husband, and some of his behaviours coming out as grumpy. He doesn't know what has happened to his old self. I would say George would be a very good referral to our cardiac counselling clinic to be seen by the cardiac psychologist or cardiac social worker and through a mental health care plan. So he would probably improve quite remarkably with some support around this, and it would be good if he was picked up by the service. Moving on to our next client, Hanifa. She had a cardiac arrest 6 months ago with an AICD implanted. It's important to note that she's got a past history of panic disorder and that this has got worse since the cardiac arrest, which isn't really surprising. She hasn't returned home since the event. She's remained at her mother's house where she feels safe. She's tearful when she talks about the events leading up to her arrest. She's vigilant regarding her pulse rate and reports feelings of panic when she has any shortness of breath. It may well be that Hanifa has some PTSD symptoms associated with the cardiac arrest, and definitely her anxiety disorder has worsened, and she could really benefit from some one-on-one follow-up. And really, we want her to get back to her life, to her old life, to her independence, and to start to thrive again. Moving on to our next patient. Rodney, he had his bypass 3 months ago. He's obese. He wouldn't like us to say that about him. He's physically inactive, works in a family business. He reports that he's emotionally feeling better as the days go by. He's completed his cardiac rehab and returned to work. So he's sort of back to his functional life, but he's concerned he's not looking after himself properly. He's made some changes, but then he knows he needs to do more. But he's finding it hard to work up the motivation and worried he'll fail again. He's the sort of person who would do really well in one of our programs, either the Back on Track or Teleheart. And the choice of the program would really be up to Rodney. Some people want that telephone, a regular telephone catch up with someone weekly and then a booster session a month later. And some people want to work through this independently on their own. So going on to our next case study, Lily, age 51, diagnosed with AF 3 months ago. And she described it as a wake-up call for her to look after her health. She says that prior to this, she'd always prioritised everyone else's needs above her own. She's clear that she wants support with adopting a heart-healthy lifestyle, has completed her cardiac rehab, but she wants something else. And either of these programs that are really focused on behavioural support, they also have emotional support in there, but their major focus is on behavioural support, would be suitable for Lily to get her goal planning up and get her having a plan to change her behaviour. And to stay changed, really, we know that people can go back to old behaviours. So they're our programs that we might want to introduce patients to, and that they may well benefit, that we believe that they may well benefit from attending. Going on to how you would let your patients know and how you would refer to us. We'll pop on to the next slide, Barb. We have our fax number to receive mental health care plan, our phone number, which we are happy to answer any queries, the website, and our email. We like to be responsive as we can to patients' needs and try to address people's needs as early and as promptly as possible. Okay.
Okay, fantastic. Thank you, Rosemary. So I think that we're now up to answering some questions. We have had a few come through. So there was just one that came through on the chat, so I'll just answer that one, ask that one first. So is referral only from GPs?
For the mental health, for the patients attending our service, the cardiac counselling clinic, mostly it's through a mental health care plan, but we individualise the care for each patient. For the Teleheart or the Back on Track program, we don't need a GP referral at all. So anybody's very welcome just to email us and we will explain and help them with any individualised questions. So happy to take a mental health care plan or happy to individualise depending on which program it is and what the patient needs.
Fantastic.
We have social workers available who are available to see patients without a mental health care plan at all. So that's another wonderful thing. So we can really get that addressed, especially some people find it hard to access a GP in some rural settings.
Yeah, great. And are our programs suitable for heart failure patients?
I would say yes. They're not The behaviour change programs are primarily designed around physical activity, healthy diet, and what's the other one? So physical activity, healthy diet, smoking cessation. Yeah. So they're just as relevant for our heart failure patients. And our heart failure patients, if it's about salt, managing fat, managing fluid, reducing fluids, and the physical activity, it's really the person sets their own goals. So we're not going to set, goals for them. They're going to negotiate their goal as to what they can manage.
Fantastic. We've had a few questions come through about costs and how the programs are sort of financed. So, Alan, maybe?
I'll do that. Yeah, so all of the programs are offered at no cost to patients. We actually subsidise a fully teleheart and back on track. That's the centre itself. And as Rosemary said, for people attending the counselling service, if they come through with a GP referral or on a chronic care plan, then that's done through Medicare. So it's bulk billed. It's at no cost to the client.
Fantastic. And we've had a great question from Stella. If the patient calls us, do we decide which program to start them in?
Yes, definitely.
Yeah, I mean, what happens at the moment is that, we then, if somebody calls directly, or as happens with about a third of our people at the moment, they're coming after having spoken initially to the Heart Foundation helpline, and then they come through to us. We'll talk to them about, just what their issue is, and talk through with them what might be the best way of dealing with that. Have one person at the moment, for example, who has come through teleheart, decided when they got to the emotional management bit that was something they wanted to spend a bit more time on, so came into the counselling program.
Fantastic. And there's been a question come through, does the cardiac counselling clinic accept interstate referrals via telehealth? And that is yes.
Absolutely. In fact, the majority, is that right, Rosemary? You've just run a report on that. I think the majority of people are not from metropolitan Melbourne.
Two-thirds are from rural, remote, 2/3 are from non-metropolitan Melbourne, and a third are from rural and remote areas. So we're going right across the country, from rural Tasmania to Perth to back of Western Australia up to Northern Territory.
And of course, because Back on Track is online, can be done from anywhere.
I see Jane Kerr's just asked a question whether is telehealth also bulk billed. It can be under a GP management, chronic disease management plan, because it's a five-session intervention. So thanks for that question, Jane.
Yeah.
There's been a couple of questions, I guess, also around. So one question was around if we, sorry, apologies, I'll just find the question. Around Indigenous, if we have any Indigenous sort of health workers, or I guess is the program relevant for Indigenous people, and also non-English speaking as well? Do we use interpreters?
Yeah, I'll let Alan answer that.
Well, it hasn't been designed for Indigenous clients, and so far we haven't used interpreters. It's one of the problems with, I guess, with our funding model, the fact that this program is not subsidised in any way by government. With a bit more funding, we would certainly like to be doing those sorts of developments of the program.
Yes, yes.
Yep.
So watch this space, I suppose we say.
Great. And Glennis has asked a question about our preferred screening tool for anxiety and depression?
It's a big question.
In the program, we use the PHQ-9, which is the recommended tool in Australia, and the GAD-7.
PHQ being for depression screen and GAD being for anxiety screen.
Yeah.
Right. And probably a question for Rosemary. Dan's wondering what the waiting time is for the counselling clinic.
We're trying to minimise the wait. We like to try and triage patients according to urgency, but we're really trying to keep them within 2 to 3 weeks of seeing that client. So that is a very important thing to us, that we don't leave people hanging in the loop.
Yeah.
Fantastic. So I think that we might have answered the questions, and unless...
There was one thing I didn't mention when I was talking about the Back on Track program, Michelle. Sorry to interrupt. Currently, we are offering the Back on Track program as part of a trial to people who have had their cardiac event in the last 12 months. And we have been funded by the HCF Foundation to run that trial. We're about 1 year into that, and we've got 1 year to go. So currently, we are offering Back on Track as a randomised controlled trial where patients are allocated either to do the program on their own, just the 5 sessions online by themselves, or they do get randomised into the arm where they do the online sessions with 2 telephone calls from one of our cardiac facilitators. We're doing that just because we have the money supporting that through HCF at the moment. But just so you are aware, it does require that patients do some questionnaires pre, post and at a 4-month follow-up. Normally we just do pre and post, which is a requirement of all services that are offered, particularly through Medicare. But that trial does require just a little bit more from the clients in terms of doing questionnaires. So just so you've got the heads up to that at the moment.
Yeah, fantastic. There's been a couple more questions come through. So I know that we're pretty much hit our time, and I don't want to keep people waiting if they need to go. I just want to mention that we will be typing up responses to all of these questions that have been asked, and we'll be putting that on our website within the next few days, and also a recording. This recording from the information session will be there as well. So you'll just need to go to our website, which is on the screen now, and just follow through Cardiac Wellbeing Program. We will answer all those questions. And I would like to just thank everyone very much for joining us. It's been wonderful to have so many people, and we very much look forward to keeping in touch via our social media and email, checking in with our website. So yes, thank you so much, and please do check our website for answering to the further questions and a copy of the recording. So thank you so much, and we look forward to being in touch. Thank you very much.
Thank you.